When she was first born, like for the first year, it was normal development, normal sort of feeding issues for less than 1 year old child. But after that, she seemed to be typically in the office here with infection or at urgent care or in the emergency room on a pretty frequent basis. That, as a result, we did a workup on her to see why she kept getting these repeated infections. CAT scans, ultrasounds, blood tests, everything came back good. So I ended up referring her to Children's, I believe it was the endocrinology department, and to just get a second opinion to make sure I'm not missing anything. And during the workup by the endocrinology department at Children's, they brought up the possibility of what's called Turner syndrome. Well, I didn't know what Turner syndrome was.
Yeah.
So I did a little research and I found out that the Cleveland Clinic is the primary diagnostic center for Turner syndrome, and so we did referral to the Cleveland Clinic. They confirmed the diagnosis, and they gave me an outline. They sent me papers on it to educate myself, and they also suggested medication and how to monitor it. Yeah, it made it easier to treat and also discuss, obviously, with parents, grandparents involved, relatives, because one of the major questions always being asked is, why she always had a fever. Mm-hmm. As part of the problem. I mean, this child was having fevers literally every week. And, is there an immune system disorder? Is there something wrong with the urinary tract? Is there something wrong with the lungs? Is there, what system is breaking down? And as it turns out, it's not any real system breaking down. It relates to the Turner syndrome and inability to, fight off viral infections.